This is the poster presentation for Food Justice Fair, a community student collaboration to address food accessibility and health in Springfield, Massachusetts. My name is Deirdre Buckley. I'm a third year at the University of Massachusetts Medical School, and my co-authors are listed below. The background on our project is that the MLK Junior Family Services Center is a community center and weekly emergency food pantry that's located in Springfield, Massachusetts. In 2017, the MLK Center partnered with the University of Massachusetts Medical School tract in Springfield to lead sessions on how food insecurity is an important social and structural determinant of health. The key point that the MLK Center wanted students to understand was that food insecurity did not represent personal failure, but rather social and policy failure. In fact, they explained to students that this was not just a food desert in the Springfield area, but a food apartheid. From these sessions, medical students were inspired to find out how they could do their part to address this issue and collaborated with the MLK Junior Family Services Center to conduct a survey aimed at learning about food accessibility and health concerns in the community that uses the food pantry. Of 172 participants, many reported that they had an inability to access necessities like food. Many people were enrolled in SNAP, and the wide majority of people endorsed many health concerns, including exercise, wanting to exercise more, reduce stress, and lose weight. The objectives of this project were to establish a food justice fair at MLK Junior Family Services Center in response to the previous surveys by food pantry participants, as well as to strengthen the relationship between the MLK Junior Family Services Center and UMass Medical School students for the goal of longitudinal community partnership. The food pantry was set up on one half of a large gymnasium and the fair was held on the other half. People could leave the pantry without walking through the fair, or they could opt in to stop by and interact with some or all of the stations. 30 medical school students from all years volunteered. Here you can see some of the pictures of our student volunteers at the various stations. The stations included blood pressure screening, bystander hands-only CPR training, a food demonstration, exercise and wellness, food assistance and enrollment, and advocacy. Of note, the advocacy station focused on demonstrating how to find local state representatives, as well as educating the community regarding the 2019 federal proposal to revise eligibility for SNAP benefits. All health education was available in Spanish and English, and once the stations were completed, participants were given an optional exit survey and a prize for participation. Some of the materials you can see here, this is the food justice handout that our group was organized. There were 3 key goals of this flyer. The first was to validate people's concerns and hurdles, as well as to describe the language we were using around food justice and food desert. The second goal was to provide information on how food insecurity impacts health. And the third was to make people feel empowered to enact change, both at the level of their own home, including suggestions on fitness and wellness, as well as at the level of the community with resources on how to reach out to local government and representatives to have their voices heard. The results. Of 300 attendees at the food pantry, 150 engaged with the food justice fair. Of that group, everyone had a blood pressure screening done that day. 70 were trained in CPR and 20 people wrote advocacy letters. In the exit survey, 97% of the people described this fair as helpful or very helpful. The majority had never been to a similar fair. And of this group, 20% spoke Spanish as their primary language. Overall, attendee perspectives were that they enjoyed the fair and felt like it was informative for them. Our discussion. So what did we learn from this justice fair? First, that the key to success was truly the collaboration with the MLK Junior Family Services Center, who is a trusted community resource, as well as that surveys year after year were crucial to informing the station design and helped us to be responsive to community need. Second, we learned that many participants at this fair were extremely interested in activism and justice. However, there were barriers to their confidence and their ability to advocate, fear of having their words twisted, of not being heard, not knowing where to begin. Medical students had an important role at this fair in breaking down some of those barriers that would allow the community to share their own powerful narratives and voice at the regional, state, and national level. Our next steps. Where do we go from here? Well, one main takeaway that we had as medical students is that physicians don't need to only advocate on behalf of people, but that they have a very important role in helping to empower and uplift community members to advocate in their own voices. So we will continue to cultivate this legacy project and strengthen the partnership with the Springfield community. In our 2020 fair that was conducted after this, we expanded activities based on the surveys we had done at that 2019 fair. We had information on diabetes and healthcare proxies, as well as advocacy efforts that were focused on specific bills in the Massachusetts legislature at that time. And lastly, our real long-term goal is to partner with MLK Junior Family Services Center to establish an accessible supermarket in the Springfield neighborhood to really address the root cause problem here. Thank you.